There we go. Let me move this out of the way. There we go. I don't hear very well, so if you ask, I will guarantee I might not hear your question, but I'll give it a really good answer. Now, the answer might not have anything to do with the question, because I want to look really smart with the answer, and I've learned that from watching political debates over the year. And I think they're genius, because somebody asks a question, they say, that's a very good question, then they answer something completely different than what the question was. So it's nice to be here. If you didn't get it, free book. My wife Rishi's right here, and if you go down to the Rhodes building where the Gulf Coast Bank is at, she'll have a box or so down there. So if you'd like to pick one up for some reason you didn't get one, just please stop by and we'll do that for you. It's nice to be here. It's sort of interesting. This week I spoke in Tampa to a number of hospital leaders, and I started out Monday in Orlando speaking to emergency room physicians, anesthesiologists, and internal medicine physicians. And it can be a daunting task sometimes to speak to a lot of people, especially scientists. It's been last year I had an interesting thing. I spoke in Chicago for the healthcare system from China. And that was pretty interesting because they all had those headsets on. And I wondered, my big thing is, would they understand my warped sense of humor? And they're just as warped as I am. So they did laugh at some of my jokes, and that was my big thought. So actually, Rishi and I are going to be able to spend some time there at a guest of their healthcare system. China's an interesting healthcare system. I don't know if you know this, but they have a lot of money. They have a lot of money right now, and some of your money. Anyway, used to be our money. Anyway. So they have great facilities. They really do. In their major cities, they put a lot of money into facilities. They have great technology. They have really marvelous technology. You can go into China and not worry about can you get to an MRI or a CT. They really do. Their challenge is what a lot of places face is the people component. Because if you don't have the people component, the facility and the technology just doesn't matter. But I'm real pleased to be here, and what I've done with this, because I always really, if you've heard me speak and people tell you around the country, I don't do the same talk, I never do the same talk. I basically try to really gear it toward the audience. When Ken and I were talking, I want to really thank Ken. When I first came into Pensacola, Ken is really one of the role models. I think Ken, when you looked at what he's done in IHMC, a nationally, internationally known company, 100 employees, bring a level of commitment and dedication not only to IHMC, but our community. The fact that there's people that are paralyzed that have robotic legs, that because of IHMC, the work that they've done. He could have said, I do enough for people outside this country, this city. I don't need to do something inside it. So the fact that over the years he's brought really outstanding lectures, and I'm not including myself in this, to Pensacola is really a treat. And why don't you just join me in giving Ken Ford a nice round of applause for that. When we talked about this lecture, what I want to do, or this talk, is really have you walk out. I'm a common sense guy. I'm not someone who gives real complex things. I always tease people. I said, we take something that can be accomplished, then we make it so complex we can't execute it. And that's when we stop. So I want you to walk out with two things today that I hope will serve you well. Number one is how to maximize your own appointment with a doctor or when you go to a hospital. How to truly control your health, and I'm not talking like Dr. Schneider about exercise, though it's important. I'm not going to talk about eating right, though it's important. I'm not going to talk about the right supplements and vitamins based on your blood type and your body and those types of things and all those things. Those are all vital. I'm talking about when you go to the hospital or go to a doctor, how to maximize that appointment. How for you to control it versus somebody else to control it. So that's going to be the first half. The second half is how are you to know when you go to a hospital, we're going to talk about hospitals tonight, but we give you a lot of other information, but in this time zone, that they're any good. How to make sure the quality is the quality that you want. How do you know that that hospital is the one that's going to get you to the catheterization in the right amount of time, which has a big impact? How do you know that that's the hospital that's got the best chance of you getting an aspirin with an acute MI, which is a huge indicator of your clinical outcome? Because some are better than others. Now, 10, 15 years ago, we didn't know that. today, through Medicare and through data collection, you can go on and by hospital find out exactly how good they are clinically and how good they are at things like managing pain, how clean they are, how well they respond and answer your questions. So I'm going to provide you a website where you can go find that information out, and I'm going to show you Sacred Heart Baptist in West Florida, and I'm not going to put the name on them, but I'm going to show you their results and how they compare, and I could put others like Gulf Breeze and Santa Rosa. I did those three, because I think if you're really interested, you can go to their website and do a little homework. And I would do homework. I really would. It's pretty interesting. I don't know about you, but my wife and I like movies. I don't think we ever go to a movie without reading a review. We never go out to a movie without reading a review. Yeah, you buy any product, we go to Consumer Report, and we read Consumer's Report. We go to a restaurant, we look at reviews and all sorts of things. We go to that restaurant, and we go to a hospital, it's, I hope they're good. You know, they should be good, they're a hospital, aren't they? And so I really want you to be able to make your own decision. I'm not here to say one over the other. I want you to be able to make your own decision. Also, on the information I'll show you, no matter where you are, you will be able to find that out. No matter what city you're in, no matter where you are in the United States, you will be able to say, this is the place I think we should go. This is the place the odds are pretty good that I'm going to get the very best care. So let me walk you through the beginning, which is going to be our own care, and then we're going to walk you through how to pick quality care is what we talked about. So that's what I want you to get out of this. Be a better consumer of your own health when you go in for an appointment, and also learn more about the quality of care of a particular organization. This was in the paper about a week ago. We're very fortunate. We don't do a lot of local work at all, but we do a lot of national work. We do a lot of work in Canada. In fact, 1 in every 7 emergency room patients in the United States will be treated in a hospital today that works and uses our services. One of those is the University Medical Center in Tucson. In fact, when I do my national talks, I've always used them as an example of a hospital that we've had really good success with before this terrible tragedy. And when this tragedy occurred, in fact, we had staff there just last week for 2 days, something hit me that I thought was interesting. The first aid on site was tremendous. The ambulances and the paramedics and the 911 call just worked flawlessly. The patients were kept from going into shock, which is sometimes shock can kill as much as the injury. They were taken to a hospital. When you're in a hospital and you're getting a lot of patients all coming in at one time, how to triage and manage that is extremely difficult. They took flawless care of these individuals. They saved lives that might have died somewhere else. Yet we heard a lot of doctors reporting on the condition, but we didn't hear a lot about the superb care that the patients got. Let me give you another scenario. What happens if the ambulance gets there a little late? What happens if they go to the emergency room, they're overwhelmed, so they go on something called bypass, which means you tell the emergency vehicle to go somewhere else? What happens if the trauma surgeons aren't available or not there to get there soon enough? They actually had a surgeon from Virginia that we actually work with, Inova also, on his way, because he's a trauma surgeon, on his way to Arizona because they treated as a military combat trauma situation. What I'm saying is they flawlessly handled it. And in our ad in the USA Today that we ran, we basically talked about what quiet heroes those healthcare workers were. But see, sometimes when it works right, we just don't notice it. Now, I'm not a big on baseball, but what I understand, it's sort of like an umpire, you know? If you notice the umpire, it's probably a bad thing. So maybe it's good that healthcare didn't get all that attention, but I really think they did a remarkable job. So we ran this in the United States. We're thanking the Pensacola News Journal for helping us do that, because they really did help us get it nationally. And we also took out a full-page ad in the Tucson paper. And when our staff was in Tucson this last week, last Thursday and Friday, she said they read this letter at every staff meeting and they sobbed. That everywhere you went, this letter was up. My message is we're going to talk about some flaws later in healthcare. But I don't want you to believe for a second that I don't think healthcare is not loaded with passionate people, because it is. I don't want you to think it's not loaded with skilled people, because it is. But what it is loaded with sometimes is some inconsistency. We have excellence in everything. sometimes just not every time and everywhere. And that's really why the Studer Group exists, to make sure we have excellence in everything, every time, and everywhere. So let's go into maximizing your doctor's appointment. I'm going to tell you what I think the best physicians do and the best medical centers do, and I'm going to assume you might not be getting it. So I'm also going to talk about, then let's not be a victim, what we can do to make those appointments work. One of the big things that we recommend is if you have any questions before you go to a doctor, if they don't call you or the hospital doesn't call you, you call them. What we do when we teach hospitals is to always call a patient before an appointment. It does a few things. Number one, it reduces anxiety because they can tell you exactly what you need to bring. Number two, they can go over directions. Anybody ever drive to a hospital and find parking a little difficult? And next thing you know, you're running late to your appointment and you don't want to be late. So now they wonder why your blood pressure is so high. Anyways, you're trying to find the right spot. And then you can't find a parking spot. I know when we work with large healthcare systems, we find if you can call the patient, let them know exactly what's going on, what to bring, what time to get there. I'll give you some statistics. No-shows go down by 70%, which is really good for all of us with healthcare cost. Tardies go down by 60%, but the patient's perception of care goes up 25%, because you bring the right medications, you know exactly why you're going, you know where to go, and the other key question to ask is, what's my copay going to be? Has anybody ever gone to walk out of a doctor's office and they tell you, here's the copay? Now, they all take credit cards today. We work with organizations, we actually tell them to collect the copay over the phone, because that way when you get there, you don't even have to worry about it. So if your doctor or your hospital's not calling you, call them. Let them know, what time should I be there again? I want to confirm the appointment. Where should I park? What should I bring? Is there a copay? Any questions you have about the test or procedure? We also found out some interesting things about when you get the call, and this is sort of for the people that call, colonoscopies. Some interesting data. Do you know women read the instructions for a colonoscopy earlier than a man reads the instructions for a colonoscopy? When do you think the guy starts reading the instructions for the colonoscopy? Oh, crud, shouldn't have ate that, huh? Well, I should have been fasting these last 6 hours, huh? Guess I can't go, can I? We gave everybody a copy of this. When we work with medical group practices, this is one of the things that we recommend that they give every patient when they come in. And what we find by that is it's called a patient visit guide, and you should have a sample of that. And you can copy it, do whatever you want with it. The reason we do a patient sample guide is because when people leave a doctor's office, they have questions. And the doctor's office very often will get a question of something they will cover. Or sometimes you might just miss what was said. My dad is an unbelievably tough consumer of healthcare. He's 90 years old. He never met a doctor's office he didn't want to stop in and see him for a while. He makes an appointment, and then he goes in, and then he tells me he went to the doctor's office. And I'm sure none of you go through this. But when my dad turned about 84, somebody told him he could use the word hell in every sentence he says. So it's always, what the hell are we going there for? What the hell do they want? You know, something like that. And then, excuse the language, this is him. I'll call him up and I'll say, what did the doctor say? He's like, not a damn thing. They never tell you a damn thing. And he's unbelievable. And one day I called him up and I said, what are you doing? He goes, I'm going to the doctor. I know why I'm going there. I can't tell me a damn thing. I don't know what the hell I'm doing this for. I said, well, why don't you do your doctor a favor? Because they need a good day too. Why don't you call him up and tell him you're not coming in today? They are not going to go through remorse or depression because you ain't there. But then I called him one day, and he really had a different experience. And it was because they did something like this to him. He had a patient visit guide. And when he went through the visit, they asked him what was his primary reason for being there, and then he filled it out. It saves the doctor's time, the nurse's time, and your time. The key things are vital signs. When people call back to a hospital or a doctor, the thing they can't remember were their vital signs. So now you have the vital signs so you don't have to call back. He also gives them information. If you need to call, here's the best number to reach us at, or call us. We also talk about medication instructions. Did you make any medication changes, or don't you? To give you an example, 1 out of every 5 patients that leave a hospital in the United States today has an adverse event. An adverse event means something didn't go exactly the way it was supposed to go. 60% of those are medication issues. And it's many times because people just don't take the medications correctly because they don't understand the directions. My dad was in the hospital one time because he came home and thought the medications would go better on an empty stomach because they would work quicker. And then he was, of course, dehydrated and ended up having challenges. Other people think if I double up on the medication, this will work a little quicker. Or, my God, I'm doing so well, I think I can quit this medication right now. So that medication becomes a key element. Recommendations, before you leave today, here's what I want to make sure you do before you walk out of my door today. You go over the follow-up care, and then you very much cover some post-visit expectations. Now, if you bring into that in the office and you use that when you go through your doctor's appointment, you will have a better appointment. But they will have a better appointment also. Because you're also going to talk about questions you might have. What's the one thing we need to focus on to assure that you have a very good appointment today? Physicians implement this when we talk to them about it because it saves them time. It saves the patient calling back because they didn't hear or didn't understand something. So one of the things I want to do is give you some tools today so when you go to your doctor's visit, your office, you can make the most of it because the healthier we can get Pensacola, we all sort of win in this type of situation. And this will help healthcare providers, if they don't do it, adapt it because they'll see how it works. These are the 5 fundamentals that we teach all the time. And the key thing as a consumer of healthcare, sure you want them to acknowledge you and thank you, but I'm going to key into 3 important areas, the I, the D, and the E. And when we work with organizations, these are the things that we really drive. I'll give you an example. About 1.5 years ago, I was speaking, and a lady from Sedalia, Missouri came up to me and said, I got to tell you, you got something on your cheek that's really bothering me. The whole time you were talking, all I could notice was this spot. You need to go see a doctor. Okay, and this is a nurse who sat there and she said, I don't know what you said, but that spot's driving me crazy. So, because I kept looking at it. So I went to the physician in town here, and they said, we're going to look for cancer. And I went, and I didn't do some of the things you're talking about. So once I'm there, I'm thinking, I wonder if this guy's good. This is getting a little serious now. And he basically, I'm talking to him. So I said to him, where'd you go to medical school? He said, I went to Vanderbilt. I said, that's good. You've got to tell people that. Because I want to tell you, my anxiety went way down. My anxiety went way down. So what I find happens is, as a healthcare professional, their job is to reduce your anxiety. That's their job. One of the ways they can reduce your anxiety, now we have healthcare professionals in the audience, is to let you know introduce their experience, introduce their education, introduce how many times they've done this. Because you feel a lot better when you have an experienced person. Now, it doesn't mean someone that might not have oodles of experience can't be good, but then they better go over the recent training they've had, why they can take care of you. Next, you want to know about duration. Duration's interesting. I don't know about you, but I went to get a colonoscopy, outpatient, and they told me to go in and take my clothes off and put a gown on. Has this ever happened to anybody? And they put me in this little room, and they said, someone will come get you in a few minutes. I'm thinking, my God, they're going to open the door and I'll be naked. So I'm ripping my clothes off, taking it off. I'm putting this gown on because I'm thinking I got like a few minutes to me is 120 seconds. So I'm sitting here and I've got this thing done. And then I'm waiting and waiting. And then I'm looking out the door. Has anyone forgotten about me? Do you know I'm in here? Duration causes anxiety. Make sure they explain to you how long something's going to take, and if they don't, ask them. Make sure they explain to you how long till you get that test back and when you'll get it back. Sometimes we have unrealistic expectations. We might think a lab report's going to come back in 48 hours, but maybe because of what they're doing, it'll take a little bit longer. It'll take a little bit less. Our goal as a healthcare professional is to really reduce your anxiety. One of the ways we do that with duration. So anyway, back to my skin. They take this slice out and they put me into a waiting room and they're biopsying it. And they biopsy it and they don't stitch you back up until they get the biopsy back to see if they have to get a little bit more. So he told me, and I'm in this, now I can drink and I'm coffee and water, and now they say, we're gonna stitch you up now. But I asked one brave question: how long will this take? He said, about 35 minutes. I said, can I go to the bathroom? He said, that'd be really a good idea. What I'm saying is sometimes we're uncomfortable because we haven't figured out duration. The last part is explanation. Do not be afraid to ask the healthcare professional to explain to you, can you tell me what you're doing? Can you tell me why you're doing it? And tell me how you're going to do it. See, we deserve that. And the more we put pressure on the healthcare professional to align with that, the better our care will be. And do you know, most healthcare professionals will do that? Some are more comfortable than others. I know we have at least one anesthesiologist here. Where are you? You are excellent at this, because anesthesiologists deal with the most nervous person in the world. Now you can say to an anesthesiologist, what do you do to reduce their anxiety? They can say, just knock them out. But they don't. If any of you have had surgery and you've had a good anesthesiologist, nurse anesthetist, or so on, they calm you down. You know how they calm you down? They say this: let me tell you about your surgeon. You have an excellent surgeon. If this was my family member, this is who I'd want to do surgery. In fact, this is who I would choose to do surgery. If you have a good primary care physician, when they refer you to a specialist, they introduce the specialist to you. They tell you why they're sending you to that doctor, why they're picking that one, not someone else. What I'm trying to say is healthcare is a collaborative partnership. And the more we bring to the table, the more we get back. And the more people can learn about our experience, the better it is. We discovered this in San Diego. I was in San Diego, and they wanted to show me a lady who did a lot of mammograms and had really patients loved her. And I said to her one day, gee, you did a nice job introducing yourself to the patient. How long have you been doing this? She goes, I've been doing this for over 25 years. I said, wow. She said, I've been doing mammograms for over 25 years. I said, do you get training every year? She goes, I go back for training every year. I'm certified by 2 different associations. I said, how many mammograms have you done? She said, oh. I said, seriously? She goes, maybe 110, 120,000. I said, you got to tell your patients that. She said, do you think that would make a difference? I think it would. Who do you want taking care of you? Do you want the surgeon that says, whoa, 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 I've never done one of these before? By the way, no surgeon will ever say that. So what I'm trying to say is this is real important. I was speaking in Philadelphia one day, and a doctor came up to me, because this is what we teach physicians to do. And he said, it seems like you're scripting me. I don't know if I like this. It's like it's a brainwash going on if I have to say these things. And I explained to him why it's so important. When Mallory, Rishi, and I in 1995 were vacationing in Deadwood, South Dakota, our youngest son, Michael, who's 23 today, we were camping. We didn't have a lot of money. In fact, Rishi and I were tent campers. The first time we it was raining one time, and to show you our camping experience, if you ever tent camp, you use these cement block bathrooms. And it was raining so bad, I don't know if Mallory remembers this, we went to Motel 6. And Mallory used the bathroom. Now, in her mind, we're still camping. And she came out and said, this is the most beautiful bathroom I've ever seen. As we were getting ready to leave Deadwood Gulch, South Dakota, my wife and Mallory were in a pool, and I was down and making a phone call, and Michael had a ball that went over a fence. And Michael had a ball that went over the fence, and he went to get it. And Rishi asked him to not go and scream, but she was in the pool trying to catch up to him because he's 7 years old. He then basically went off and bent down to pick up the ball, And when he bent down, just ironically, a 4,800-pound bobcat was coming down the hill, didn't see him, and ran over him. And I was in the room, and I heard somebody yelling, "Call 911, a little boy's been crushed." And you know, I had this feeling it was my boy. I just had that feeling it was my boy. What happened next is Rishi was banging on the bobcat because he didn't know he was resting on top of Michael. He just thought when they interviewed him he was on a pile of dirt because he shouldn't have been, you know, the way these things happen. It just happened. And it pulled back off him. And I can't tell you in a matter of seconds, the paramedics came. Rishi said they had a heartbeat. They put him on a stretcher. They took him to Deadwood General Hospital. Mallory and I got in a van and tried to get to the hospital. By the time we got in the hospital, he was already in an x-ray, all these things. He was bleeding internally, his shoulder was crushed, and they couldn't stop the internal bleeding. They told us they were going to transfer him to Rapid City, South Dakota, to a pediatric intensive care unit. Rishi hopped in the ambulance. They go to the pediatric intensive care unit. Mallory and I follow in the van. By the time we get there, he's up in an ICU. He's got a crushed shoulder. He's got him on morphine. They got him on a respirator. They've got him in a device for all the urinary. They've got morphine pumping into him, and he's just floating out blood. And by the time I got there, they'd all been in there, the healthcare team, and I asked Rishi, is he going to live? And Rishi said what every mother would say. What did she say? Yes. You have to believe that. And I started asking her a question, and she said, the doctor's right out there. So I went to ask this doctor, and what I really wanted to say to him is, do you know what you're doing? Because what hospital do you want your son in? The best. So I said, do you know what, I didn't say that. I introduced myself, told him I was a chief operating officer at Holy Cross Hospital in Chicago, and I said, is Michael going to live? And he said, I can't tell you that. It's going to take 48 to 72 hours to really know for sure. But now I got aggressive. I said, doctor, where'd you go to medical school? And he said, I went to the University of Michigan, and I think he knew where we were going. Because he said, I also did a residence in pediatric medicine, and then I did a 2-year fellowship in critical care. I'm a double board certified physician in pediatrics and critical care medicine. I walked into my wife's room, looked at her and said, we got lucky. What this is about is reducing anxiety. What this is about is saying the things so the patient and the family feels better. By the way, here's some other interesting information. The more this is done, the more compliant the patient is. The more I know my doctor knows what they're doing, they have experience, they explain things, the more compliant I am. Because the biggest frustration in the medical field is patient not being compliant. Does anybody maybe never compliant? I used to work in the drug and alcohol field. And the guys would come in and say, the doctor missed it. Never told me I was an alcoholic. Missed it. And somebody would say, did you ever tell him you drank? No. You ever tell him how much? I might have minimized it just a little bit. This is called AIDET. And what I'm trying to say is do not be afraid to ask somebody what's your experience, how long are things going to take, and can you please explain it? The next one is, this is an example of Oklahoma University. This was before an organization started using AIDET and after. The dark blue is the patient satisfaction before, the light blue is the patient satisfaction after it. So it shows the impact. Also, when a healthcare provider says, do you have any questions? They actually want them, even though they might not look like it. We find many people are reluctant to ask the doctor a question. When we teach physicians, we do a lot of this, we say to them, don't say, do you have any questions? Say, what questions do you have? Because when we say, what questions do you have, it opens the door to it's okay to have a question. But please ask that physician or that nurse that question, because they truly do want to know it. Because if you don't, you're going to call them anyway, you're going to find out, and you're going to have some interesting information. Also, reward and recognize people along the way. We find that healthcare workers don't think because what they do, that they just get it. For that nurse that does a great job, say, I really appreciate that. For that doctor that explains something, say, I really appreciate when you explain it. Does anybody know Gwen Applequist? Okay, Gwen Applequist, when she was in a nursing home for a while after her foot surgery, changed the entire nursing home, in her room at least. When I first went to see her, it was incredible. Next thing I know, her room's clean. She's got flowers. She's got food. And then I listened to her. Every time one of the employee did anything for her, she showed such appreciation. Oh, thank you for moving my pillow. Thank you for bringing me my food. Within 3 days, she had behaviorally modified every employee in that organization to take care of Miss Gwen. And she did it through reward and recognition. The last part of a good visit is a phone call. If you're at a good hospital, you should get a phone call when you leave, because 1 in every 5 patients will have questions about their home care instructions and their medication. You should get a phone call that should ask you how you're doing. They should go over your clinical outcomes to make sure everything's okay. They should ask you what staff should recognize so they can bring that in. They should ask you about the quality of care, the process improvement, anything we can do better, and they just want to tell you thank you. Phone calls are crucial. We work with community health systems in the United States of America. They're going to make 1 million phone calls this year to every patient that leaves an emergency room. Because what they find out is only 14% of patients that leave an emergency room truly understand the home care instructions or the side effects of medication. I bring that up because if they don't call you, call them and let them know, hey, I want to make sure I'm right here. I want to make sure I understand this because it is your health. So this is the difference of a patient. This is when a patient gets a phone call in the light blue, how they how they understand the instructions of their care, and this is when it's dark blue. I bring these up because as a healthcare consumer, the pre-call, the visit guide, the key words, the key times, introduction, duration, explanation, and the post-phone call will make sure you get the very best care that not only you deserve, but the family deserves. And you'll actually help the healthcare person provide you with better care. And you know, for healthcare professionals, your litigation will go away. People sue healthcare providers because of poor explanations and bad handoffs, not because of bad care. So now let's talk about quality, how to judge clinical quality. We call it evidence-based care. Evidence-based care is basically where now in healthcare there's enough research to say if we treat certain things a certain way, we'll have the best clinical outcome. Now, it doesn't mean there's not going to be differences between one patient with diabetes or not, but they know there's certain consistent things that'll end up making sure you get better care. Some of these are aspirin on arrival with an acute MI. Some of these, the PCI means how quick can we get you to a cath lab when you come in with something that would need to go to the cath lab. Handoff communication, SBAR, is basically a medical term saying that we understand the situation and we move the handoff the exact same way every time. It's all about handoffs. There's medication reconciliation to make sure that we're always making sure we've got the right medication, the right person, the right time. There's discharge coordination, so we don't drop anything, don't miss anything. Hospitals that do the best in these, you get better care. Now, where do you go? You can go to hospitalcompare.hhs.gov. If you're going to write one thing down today, that's the thing to write down, because that's going to give you access to a lot of information that you might not be aware of. And I'll repeat it again at the end. Now, you can compare hospitals. You can compare how they do clinically. I mean, how many of you have ever, before you bought a car, did a little bit of research on it? Yet when we go to the hospital, we hope to gosh it's good. Now, by the way, the more demanding we are in the community, the better our healthcare providers will need to become. We all win in this. And by the way, I think our healthcare providers want to do a good job. No healthcare provider goes to the hospital and says, I can't wait to alienate a few patients, ignore a few families. And, you know, I haven't met an attorney in a while. Some litigation would be fun. You know, let's have a real ball here today. So I was I'm going to be here at this hospital February 18th. This is in Jonesboro, Arkansas. They have 2 hospitals. They have Hospital 2 and Hospital 1. You can go onto their site and you can see exactly how they compare to each other and exactly how they compare to the national statistics. So let's look at one of these. Heart attack patients given PCI, which means get to the right place for your heart, within 90 minutes. The average of all hospitals in the U.S. is 89. The average of all hospitals in Arkansas is 84%. Now, at Hospital 1, it's in the 98th percentile. And isn't it amazing that's the one that hired us? The good always want to get better. It's sort of the bad just think it's somebody else's fault. Tough patient, who knows? The other one is the 85th percent. Heart attack patients given an ACA inhibitor, and that's just some clinical terms, but the national average is 96, and hospital 1 is at the 99th percent, and hospital 2 is the 73rd percent. Jonesboro, Arkansas, it's not going to be like this town so big to get from one side to the other. Where do you want to go? I'd go to 1, wouldn't you? I'd sort of go to 1. Let me walk through something else, readmissions. We also know that even though the care might be different, the readmission rate's about the same, because you really don't want a readmission. And so you can even go in and see what type of readmission rate does that hospital have. This is all available on that website. You actually type in your town, you type in the hospital, and you can go side by side and compare each organization. Our company is growing very quickly because of this. Because also for the first time, Medicare is holding back payments to hospitals based on outcomes. In the past, if you fall, I got paid. You know, you fall, even though it's my fault, I still get paid. It's a heck of a deal if you can get it, isn't it? It's sort of like you bring your car in, I smash up the back end and say, hey, whoop, got to still pay me. It's my fault, but pay me. Today, if you fall in a hospital, I might not get that reimbursement if it's my fault. They call them never events. We're one of the only industries that count never events. Does anybody see something strange what I just said? Because if it's a never event, it should be a never. So what the government has done, and I think it's good, is they're holding back payments now. And they're saying to hospitals, we're not going to pay you your full Medicare amount. We're going to hold some back. And then we're only going to pay you if the quality and the clinical quality is at a certain state. That is good for healthcare. So anyway, we have hospitals around the country now that the local newspapers are running their results. And it really creates a transparency that I think is good for a community. So let me talk about HCAHPS as we finished up. HCAHPS is basically to judge your satisfaction with the hospital that you're with. We go clinical outcomes before. Now we're going to talk about a little something else. It's part of what we call pay per performance, or when you hear them talk about value-based purchasing, that's what we're talking about. I like it. Here's the website again. What it does is when a patient leaves a hospital, the government, either through another vendor, a measurement company, or themselves, will contact patients. And they're going to ask you about nurse communication, doctor communication, responsiveness, pain management, communications about your medications, discharge instructions, cleanliness of the hospital and how quiet is it, and overall rating, and then would you recommend it? Now, would you recommend says an NA? That's only because that's not part of the payment system. But you can still see that could be of value to you. The other thing they've done, which is new, is they put in always, usually, sometimes, and never. Because in the past, Charles, I would say to you, did the nurse explain your medications? You would say yes. But if I said, did they do it every time? Maybe not. So it's really raised the bar on hospitals to be consistent is what we've been talking about. Now, some of the things you hear is, whoa, I have sicker patients than others. It's all adjusted for severity. Gee, some of my patients don't speak English. It's actually adjusted for languages. I get more patients that come through the emergency department. It's actually adjusted for that. So it's the first real apples to apples comparison we've ever had in the United States. And these are the areas that are evaluated. So let me show you how we do locally. How's that? Is that all right? Now, one of these is Baptist, one of these is Sacred Heart, and one of these is West Florida. So one of these is West Florida, one of these is Sacred, one of these is Baptist. So one of these is Sacred, one of these is West Florida. I'm trying to mix it up, you know what I mean? Aha, did you hear the sequencing he did? You can find out, because you can go on that website and you can see. About 50 percentile means it's the national average. About 50 percentile means it's the national average. So in Always Quiet at Night, 2 of our hospitals are about national average, and one of them is a little better. That might mean you rest more, it might mean they have no patients. But the reality is, so I can't tell you the why, I can just tell you the results. here, doctors communicated well. We're all about average. So we're sort of about in the game, but not bad, not good. We're just about average. Now, nurses communicated well. The gray line shows that there's a difference between that one, the other one, and the other one actually drops to a 48. So you've got one hospital that's above average in nursing communication, well, average, and one that's below. By the way, the key driver of healthcare satisfaction for a patient is nurse communication. Because you see the nurse more than anyone else. So if the nurse is if there was one thing I would pick here, nurse communication would be important to me. All of them do a very good job in pain management. So all of them, no matter what hospital you go to, is going to be above average. You know, in the top 30% of hospitals around the country in the area of managing pain. Now, one of them is much better than the others in receiving care. By the way, this will be interesting if you go into a hospital. Ask if the nurse will come visit you every hour. Hospitals where the nurse visits a patient every hour, the odds of you falling are cut in half. Because you don't get up to go to the restroom because they're going to be there. You don't go up to reposition yourself. I'm trying to say is, let's be good consumers. And if we're good consumers, we'll have better health care. Because health care will meet the consumer demand and the consumer information. Because it's not a matter of passion. It's not a matter of skill. Sometimes it's a matter of focus and flow and reward and recognition and fixing processes. So now let's go here. Probably an area that in Pensacola, you know, if any of you are a consultant in room cleanliness, there's an opportunity for you. And that's an area that's not where I would think that we want to be. And I don't do this to cause, you know, these, by the way, when people say, well, you should, that's not my data. These are patients that visited these hospitals that share the data. Now you go to staff explained medication, and you got 2 of them that are in the top 30%, and you got 1 of them that are below the 35th percent. I hope if you're a board member in a hospital, you see this data. I hope you're watching this data, because unfortunately, I would tell you sometimes good data gets shared, and sometimes data that isn't that good doesn't get shared, or it gets sort of described away. You were there when I first came to Baptist Hospital, our patient satisfaction wasn't that good, and I was told it was a Navy town. Anyway, I know, what does that have to do with it? I don't know, or, you know, they got these helicopters. Here's what I find. If people want to believe something, you don't need a lot of evidence. And if they don't want to believe it, you can have all the evidence in the world and it ain't going anywhere. Patients giving information, wow, one of them was significantly higher than the other 2. Patients who gave a 9 and 10 is where we're going to get paid on. Hospitals in the future will be reimbursed on this. And what it means is 2 out of the 3 hospitals here would probably not get their reimbursement from HCAHPS for Medicare because they weren't meeting the expectations at certain levels. And the last one is likelihood of recommending. So what that sort of gives you a chance is to go to Hospital Compare, go in and say, I'm looking at this hospital, and this, oh, by the way, you can look in Santa Rosa, you can look up Gulf Breeze, you can look up anywhere you want. If your kids live out of town, you can look at there. If your families are traveling, you can look at there. I believe all healthcare tries to do the best job they can, but there is a difference. And the better we are as a consumer, the better our providers will be. Well, isn't that true in any other industry? And it's true in healthcare, just like anything else. So why do we do this? We're real lucky at Studer Group. Even though we don't touch patients, we touch people that touch patients. And on a regular basis, they will write us notes. They will send us notes from patients. And this is, we do a lot of work in Canada. And this is, Dear Dr. Waters, thank you for saving my mom's life. It means a lot to me and my parents and my whole family, but mostly me. I might only be 9 years old, but I still have a big heart. And what you have done to my mom is just wonderful. It is the best this anyone has ever done for me. I will always remember you. So I do want to tell you that healthcare providers are passionate, they have great skill, and they want to do a good job. And the way to get great healthcare is to work truly in partnership. And this transparency allows us to work in partnership and quality, and being a well-prepared patient before the appointment, during the appointment, and after the appointment makes us a better consumer and being better consumers makes us a healthier community. Thank you very much for allowing me to do this. Pardon? Sure, go ahead. I'm sort of in. Go ahead.
What caused you to change? What caused you to change from managing a hospital to leading a revolution in healthcare performance?
Well, I don't know. I think what caused me to change for me, what was the fact for me? Because if you read my book, Hard-Earning Excellence, and saying you got it for nothing, you should. Anyway, I guess understanding the impact we can have. And then you get to a point, I think, you get to a point in life, and it wasn't me, because I didn't want to lean forward. I was a wobbler. Most of my life, I was a wobbler. If it looks good this way, I lean this way. If it looks good, I lean this way. In 1995, I was in an inner city hospital in Chicago that had a terrible, terrible, terrible neighborhood. In fact, I remember when I started at Baptist, somebody came up to me and said, this is a tough neighborhood. I said, it's Boca Raton compared to where I just came from. Everything's relevant. And so I got introduced to speak, and a fella got up and said, Quint's a fire starter. We all need a flame, and in healthcare, morale is low. Patients are concerned, doctors are disgruntled, employees don't feel satisfied. And he said, Quint Studer is a fire starter. Then explained in earlier civilization that you had to keep a flame alive. And if you let that flame die, the civilization died. And I'm not putting me up with that. But I got up on stage, and for some reason it hit me. I was in my mid-40s, and I really didn't ever step out. Oh, I stepped out when it was convenient. I'd say I'm behind you, but I really never stepped out. And at that point, something hit me, and I just said, I want to step out. I want to make a difference. So I think it's a lot of emotion, and I think it's a lot of spirituality. You just get that feeling that you got to step out. So that's it, if that's okay. Yes, sir. We got to get a mic.
As you know, we're very polarized right now in our country about what we need to do with our health care at the national level. I would be interested to know that if you were king for a day or a month, what you would do to our healthcare system in the United States to help us with cost and quality.
First of all, I decline the position. Can you imagine the blogs I would get then? I think the challenge you have in a healthcare system, real quickly, it's been so dysfunctional for so long. Let me explain. When Medicare came about, it started paying hospitals for patients. But then what happened, like all happened, Medicare was never meant to cover everything for everybody. It was a safety net. And then what happened is, with all this coverage, everybody started getting care, which is fine. But then what happened when the government would lower the cost to a hospital, in order for a hospital to make up that care, they would shift it to the insurance company. So they would shift it to the insurance company, and when they shifted to an insurance company, that got rates for higher here. So the less people that could pay you, the more you skewed your rates. So it got to be where everybody could pay a different rate, get a different rate. And then it's one of the only places where you don't have to have any money and you can come in and get service. It'd be like me going into Don Allen's clothing store and just saying, I have no money, I'm indigent, but I'd like 4 new suits and I want the top brand. You just can't last that long. So there's no easy answer. And there's also the fact that, of course, our healthcare dollars are going to go up, our aging population. One of the great reasons our healthcare dollars is going up because the population is aging and it's going to need more care. What I would do is certainly pay for quality instead of volume. And what happens right now is healthcare providers get paid many times for how many they do, not how well they do it, not what the outcome will possibly be. So there's no easy change. I was visiting with Paul Ryan about 3 months ago, and I asked him, I said, there's certain best practices in healthcare, like I just showed you. Shouldn't all the hospitals be doing all these? Should there be this type of variance? Absolutely not. So I said to Congressman Ryan, why don't you standardize certain best practices that all hospitals have to do? He said, nope, we're just going to pay them this much money. And in order to survive, they're going to have to do these things. Because if we quit paying for falls ain't going to happen. if we could fall in for infection. So there's no easy answer, except I will tell you being better consumers is the best answer. But we're still going to pay for it. I mean, that's the other thing that they've seen. Even if you're real, Tom, if you're my doctor and you keep me really healthy, I'm still going to get something sometime. So it's just a prolong. So here's what I tell my good friends. When you don't know the answer, you talk a long time. And obviously, I don't know a good answer to that question. Right here.
I've looked at the patient visit guide, and I do quite a bit of that, and my doctor seems to do it. But if I ask him a question, he gives me an answer that maybe you could use if you were going to medical school or something. He talks and talks.
Right, they're smart and smart. Ask him to explain it in a way that you can understand it.
He goes on, and I just like to leave.
You know what the crazy thing is? If he knew he'd want you to leave, he'd be okay with it. I think you need to then say to your doctor, doctor, if it's okay with you, once I understand what you're saying, I'm going to let you know, because I knew you're a real busy person, and I know you want to do such a good job explaining. You might actually explain more than I ever know. It's a lot like marriage. Has anybody ever said you're right? You're right. How many rights do you get to when you're really saying shut up? So I really think, I think this doctor, first of all, I'd say, hey, I really love the way you explain things to me. It's so helpful. A lot of my friends don't get that. But for your time and for your sake, if it's okay with you, once I really think I understand it, I'm just going to say that's okay, because that'll allow you more time with other patients. He'll be appreciative. Roger?
Quint, there's a nurse in Gulf Breeze who wears a white hat, a white dress, white stockings, white shoes. I think she's the only one. What do you think about this? And I think she's the best nurse. What do you think about this trend where the nurses and the aides and the floor cleaners and stuff all look alike, sloppy?
Well, I got to tell you, Roger, do you know any RNs? Yeah, they don't have a suck-up bone in their DNA, Roger, I just want to tell you. I think the main thing is the professional appearance. I think the main thing is a professional appearance. Where it's white, where it's not white, it's a professional appearance. I will say this, many hospitals today are going very much back to the nurse. Certainly you know it's a nurse. Whether it's something they put on, whether it's something that they have, because you really like to know who's taking care of who. Now, I'd love them all to go back to that, but the odds of that happening are zero. And but yeah, I think it's all about professional and cleanliness. And the other thing too, this is another thing. When a person in healthcare goes to touch you, don't be afraid to say, have you washed your hands? We teach our patients in hospitals we work with, even though everybody's supposed to wash their hands, let's not assume it. So let's just say, I'm just checking if, did you wash your hands? They will quickly do that, because as you know, hospitals have infections. And the better we can all do with hand washing, we can save $2 billion a year in hospitals if we washed our hands better. Did you have a question up here?
I'm a nurse practitioner, and I'd like to say I appreciate all the wonderful things you have to say about nurses. But one of the measures of quality, I know there's good data on the ratio of nurses to patients in healthcare facilities. Could you comment on that, and is that being measured in our local area?
I'm going to be disagreeable on that one point. I think you can't look at one metric. For example, you have to look at what type of patient load. You have to look at what type of experienced staff. You have to look at the nurse manager, for example. In one unit, if all the nurses have 10 or 12 years of experience, I might not meet as many nurses for those patients. But if I'm in a unit where I got a lot of new nurses, I might need a lot more. I think the best person to really make that decision is the manager. But you've got to look at your acuity and your mix. Because if you just say, well, you have to have this many nurses for this many patients, there are times where you'll have too many, and there's times when you won't have enough. So I think we did a study on span of control. And what we found out is there was too many other factors to come in and say there's one factor that makes the difference. I will say what does make a difference is nurse turnover. Nurse turnover creates mortality. There's a number in healthcare called the mortality index, and you can find it out online at all the hospitals you go to. And if the mortality rate index is below a 1, that means people that were supposed to die. If it's a 1, it means people who should live lived, and people who died died. If it's above a 1, it means some people died that should have lived. And if it's below a 1, it means some people are alive that should have died. Now, I don't know about you, but I'd go to a place with a low number. Okay, and truly I would. And one of the impacts of that is nurse turnover. Because when you have new nurses, you have new handoffs. And the big thing about healthcare is flow. In the average hospital, there's 12 handoffs every day for a patient. And that's 12 times that you can miss something. So that experience of a nursing staff. Today in the economy, there's not as much turnover. But people used to say to me, if you were going to a hospital, what's one of the first questions you'd ask? I'd ask, what's your RN turnover? Because the more retention you can hold your RNs, the better clinical quality you'll have, because you have experienced staff with good handoffs. Donna?
I don't have a question. I just want to thank you and Rishi for all the things that you do for our community.
Thank you very much. Thank you. You want to do 2 more? Dr. Jones and then this lady right there.
Most doctors, you go to a doctor, they go to a hospital. What if your doctor goes to one of the lower quality hospitals? What should you do?
I would tell him you have concern and about these matters, and ask him to assure the excellence that you have. And if he goes to one of the 2 hospitals, he'll go to the hospital that you want him to go. The doctor will allow you to have influence over that decision, because he wants you to reduce your anxiety. And by the way, it makes the doctor, don't think the doctor likes this. The more clean a hospital is, the more responsive it is, the better the pain. Doctors have to handle a lot of things if it's not handled. So number 1, I would say, here's the hospital I want to go to. And the second thing I would do is say to the doctor, could you help assure me that I'm going to get the excellent care there? And I think physicians can. But remember, physicians many times, the hospital stay is, you're going to see the physician a lot less than you're going to see probably anyone else. But many hospitals have hospitalists, and that's another thing. Those are specialists that only take care of inpatients. Have high expectations of those individuals, because that's what they do every single day. So if you get a hospitalist and it's not your normal doctor, don't think that's bad. That can be sort of good, because that's somebody that lives in the hospital every single day. Last question, please.
In terms of getting a handle on some of the really dramatic escalating costs in healthcare, wouldn't it be helpful if we did something more about litigation and the litigious society that we're in, the frivolous lawsuits, so many of them perhaps loser pays all or loser pays a portion?
If you saw me on Morning Joe, that's what I said, and Howard Dean didn't agree with me on that one. Even though, and this is my point, even though when you look at litigation as a dollar amount, it's very, very small, and that's what you're going to hear. And there's a lot of healthcare people in the room. There is something called defensive medicine. There is something called, if I'm up, maybe I'm going to do this. So yeah, I think we should deal with tort reform. I truly do. Well, thank you very much. I appreciate you being here today.